All right, so our grants team consists of me, the grants coordinator, and then we have 2 grant specialists, Vicki Robinson and Kathy Ediger. We are available Monday through Friday, 8 to 5 in the grants email. We will always be monitoring that email. And then if you call the office and ask for somebody on the grants team, they should put you in touch with one of us. So anytime you're inquiring about the grants, one of us should be helping you. So what are the Child Care Impact Grants? These are established by Child Care Aware of Kansas in partnership with KDHE and DCF. These are intended to provide financial support for child care programs to address facility and needs related to health and safety to mitigate COVID-19. So these are CARES Act funding, so they will be centered around COVID-19 and mitigating the spread of that and keeping your facility healthy and safe. All licensed child care providers in substantial good standing with KDHE are eligible to apply. In the Q&A document, we will put a little definition of what it means to be eligible in good standing so that you can make sure that that pertains to you and that you're able to apply. What can the grants be used for? We have 2 categories that you can apply for. You can apply for one or the other, or you can apply for both. So we have minor renovations. These must clearly support your program in meeting health and safety guidelines and mitigating the spread of COVID-19, or meeting the requirements of the Americans with Disability Act. We have a request guide on our website that has some ideas of things that you could request with under that category. And then we have the other activities and expenses category. So they may be considered if determined necessary to restart or continue operations safely and not covered by other funding sources. So we also have a list for those. I will just show you real quick on our website. If you haven't been to the grants page on our website, this has a lot of information for you regarding what to apply for, extra documentation that has resources for you. This page has definitions of what the grants can be used for. We have the grant submission checklist. If you are mailing in a paper application, you can find all your documents here. We have those request guides, like I said, and then a preparation worksheet that you can fill out and kind of prepare yourself for answering the questions in the application. And then we have some other resources too. So from this link right here, the apply now, you can get to your provider profile to apply for the grant. You will have to log in as opposed to getting the email and being logged in automatically. And that is the most preferred way for you to apply. So in looking at these lists for the request guides, we have some ideas of minor renovations. They are not all inclusive. So there are things that would qualify that are not on this list. But just because you are applying for something on this list does not guarantee that you'll be funded. This is a competitive grant. So I just want to make that clear. And we do get a lot of requests like, is this, can we request this, or would this be approved? Really, it is a case-by-case basis and based on your need, and everything must be tied into COVID-19 and helping your facility in health and safety, meeting those guidelines. So these are some examples. Renovation examples include additional hand washing stations, program ventilation needs, health screening location or sick child isolation areas. Flooring, we would like to see carpet being replaced to a easier sanitizing floor such as laminate or vinyl flooring. We would not recommend doing carpet to carpet. We really want to encourage easier cleaning, easier sanitation. And then the minor renovations related to meeting the requirements of the ADA. So like wheelchair ramps, handrails, widened doorways, etc. If you are doing this work on your own, you may request those materials needed to complete the job. Tools will not be approved for that. You may request work or labor from a contractor to do these jobs, and then equipment to help those renovations. And then other activities and expenses. This could be supplies, materials, technology, or equipment. So PPE, cleaning supplies, hand washing supplies, things like that. Materials could be classroom materials, additional toys for individual play, and more frequent rotation and cleaning. Outdoor play toys and manipulatives. Technology, computers, tablets, printers. We do recommend that one computer per adult in the program be requested, or one tablet per adult in program. You can request these for children too, like the tablets for children, if you're wanting to, reduce sharing. Equipment, so we could do storage needs, room arrangement needs, and then appliances. So high heat washer and dryer, dishwasher, sink, vacuum, or carpet cleaner. So those appliances that would help you in mitigating the spread of illness. So those are just some examples. We do encourage you to think of things that you think would directly help mitigating the spread of COVID-19 in your program. Every program's different, so needs will vary and approvals will vary. All right. So important dates to remember. We launched our applications on March 15th. You have until April 15th to apply at 5 p.m. We are encouraging you to take your time on these since they are competitive. We do want you to write really good and thorough and complete rationales and narratives in your grant. We don't want you to try to rush it to get in way before the deadline, because this is a competitive grant. It's not a rolling process. So we're going to start reviewing them after the 15th of April. We're going to allow everyone to submit their grants before we start reviewing. So at 5 p.m. on April 15th will be the last time that you'll be able to submit a grant application. We are not going to be taking late applications at all. So if we receive your application at 5:02, you will not be able to submit your application for this grant. September 15th is the date that all unspent funds must be returned to Child Care Aware of Kansas. And then all receipts must be turned in by September 30th. So I know you had kind of a shortened timeline last year when we did the other grants and things were out of stock. So hopefully with this grant, you're able to get what you need to get and have a little bit longer timeline to get that. And now that the rationing is over of all the toilet paper and cleaning supplies and stuff like that, it might be easier to find those items that you need. So we're really grateful for that. So the process overview, technical assistance will be provided throughout the process from me and the grant specialists. We do prefer that you contact us via email. It will be easier and quicker to get a response than calling us. We do have limited amount of staff in the office right now due to COVID and just trying to prevent that spread. So it will be easier to catch us in email. And I know if you have emailed us already, you know that it's pretty quick that we get back to you through that way. Like I said, the Q&A form with questions from these webinars will be posted on our website along with a recording of one of the webinars. This will be for your reference. So when you're completing the application, you can go back and look and see what I said about this part of the process, or what are other people asking about, and you can get those questions answered, hopefully. So our preferred process for submission is through our WLS system, which is the provider profile that you guys have through us. We have sent out an email that you can just go directly to your profile. If you need that again, you can always contact us if you don't know your password or need help getting that. We can also help you with that. We do prefer this way because it's easy, and I'll show you in a few slides that it's easy. Everything's right there. Your W-9 and direct deposit are embedded in the application. So you don't have to submit any extra forms. You don't have to upload. You don't have to take pictures. All you have to do is type in your application. We do need an updated W-9 and direct deposit. So like I said, in the WLS system, it's within the application. It has 9 spots for your routing number so that we can ensure that you're typing the correct number and getting your information correct the first time. Paper applications will be available to those with limited technology access and to Spanish-speaking providers. So we are going to have all of our documents, such as the request guides and all of the supporting resources available in Spanish for Spanish-speaking providers. And we're also working on trying to get like a webinar or a recording or something kind of like this so that we can provide that for Spanish-speaking providers so that they have all of the necessary resources that everyone else does. So this is going to be a traditional grant application process. We're going to have technical assistance, the deadline, then we'll review. We will send out approvals and denials at the same time. Those should be out around mid-May. Everyone will hear at the same time. And then your disbursement of funds would be within about 2 to 3 weeks after you get your award letter. And then after that is the receipt and impact story collection. So we are trying to build that within our WLS so that it makes it easy for you to just hop on there and upload those so you're not having to mail everything in or email everything. I mean, if you want to, we can work with you on that, but it should be easy for you to just access it on your profile. So the application, like I said, completed in your WLS profile is the preferred way. This is not supported well on cell phones. So if you are having trouble and you're calling us and saying, help me, I can't view this box, first thing you should do is probably try a computer. This application is not made for cell phone usage. If you don't have a computer, I would recommend that you fill out the paper application version. You'll have an easier time doing that. If you are doing the paper application, you will have to mail an updated W-9 and direct deposit form with your application. So those are available on our website, or if you would like to have us mail you an application packet, we can, and we will mail those documents to you. So yeah, they can be mailed or faxed back or emailed into our grants email. And then the paper application translated to Spanish will be provided to those Spanish-speaking providers. So on your application, you will have a budget request item section. This will be where you will put where you're going to purchase the item, the category, and then the rationale. So how it will help your program in mitigating the spread of COVID-19. And then you'll include the cost, the projected cost. I would include shipping and taxes, just so you're not surprised later by having to pay them out of pocket. You must use the application budget form submission in WLS if you are doing it on there. We will not allow any uploads into your profile because we don't get notified when those are uploaded, and I just don't want anyone to miss out on the opportunity because they uploaded instead of submitting through the application where it would notify us. The review process. So like I said, after April 15th at 5 p.m., we will start reviewing. It's not a rolling review process. It's not first come, first serve. We do want you to take your time. We do want you to be complete and thorough in your narratives. This is competitive due to the limited amount of funds. Applications are encouraged to be thorough. We do want you to complete all fields just so we don't have to, we're not going to be following up like we may have in other grants. We're going to really leave it up to you to fill out the information as completely and thoroughly as you can, because there are going to be a lot of applications and we want to get these providers funded as soon as we can. So the notice of decision and awarding, these will be sent to programs mid-May. In the award letters, there will be a list of the budget items that were approved. So you'll know immediately which ones you were approved to purchase. If you are comfortable purchasing these items before you get your funds in your bank account, you may do that. You just must receive your award letter beforehand. You should allow 2 to 3 weeks for funding to be deposited in your bank account. So the award amounts depend on the type of program and the capacity. So family and group childcare homes can receive up to $4,000. Other programs based on capacity. So if you have a capacity less than 50 children, you can get up to $5,000. A capacity between 50 to 99 children, you can get up to $6,000, and between 100 and more children, up to $7,000. So we do try to keep your requests around that area, so it's easier for us to just go through those and award, and not have to take off a lot and deny a lot of them to keep within the range. In WLS, there will be a space next to each budget item to upload receipts. So next to the item that you were approved for, you can upload the appropriate receipt to that. You will have until September 15th to return any unused funds, and then until September 30th. So WLS, I will show you after this slide a little preview of our grants application in your profile. We're really excited about this. This was a lot of work from many team members and trying to make this as easy as possible for you guys. So providers will each have a grants tab in their portal. Applications will be completed in this tab and can be saved and gone back to later, so they're not losing their information. If you guys are trying to complete it during nap time and kiddos wake up, you can go back and finish it up later. And also, if multiple grants happen at one time, all grants can be in one place to avoid confusion. So I will show you what this will look like to you. So once you get that email and you click on your link to get into your profile, you will come to this page. So this is your update data page. Go over on the top here to the grants tab, and you will find all of the grant information available to you. So right now, the only available grants at Child Care Aware of Kansas are the Child Care Impact grants. And then it shows the deadline of these grants. So last year, I know there were several grants happening at one time, and it was very confusing to know which one was which and what you had applied for with what grant. And so this will help it if there is any other opportunities. This will help kind of keep that organized. So you can click here to start filling out your application. This will pull some information like your address and stuff like that. Every field that has a box, a text box, you do want to fill all of those out. So if you don't, it will pop up in red to have you go back and re-look at those. As far as the number of children enrolled and number of current openings, it does require those fields to be full. So if you do not have any that pertain to you, just put a 0 in there so that you can move on to the next one. And then, like I said, there are save buttons throughout the application where you can save and then go back to it later.
Excuse me. I'm sorry. I was late getting on because of computer problems. So can we ask questions while you're doing this, or should we wait till the end?
Everyone should stay muted just because we do have so many people on here. You can type in questions into the chat box. We are going to be answering those within the chat box throughout the webinar. And then at the end, we will have a little Q&A time where we will read aloud some questions that are being asked more frequently and answer those.
Thank you.
Thank you. Okay, so like I said, you can save this and go back to it later. And then down here, you have questions for your narratives. So this is just talking about what you're applying for, why you're applying for it, how it's going to help you mitigate the COVID-19 spread and other illnesses, and then how it's going to help you with health and safety. So if you're doing a minor renovation request, you would do this part, and then if you're doing other activities or expenses, you would do this part. So like I said, you can apply for both of them, or you can apply for just one of them. And so that approved amount that you can get up to, those will be, you would have to fit all of this under that amount. So it's not $4,000 for the minor renovations and $4,000 for other, it's $4,000 for all of it together. And then here it will ask you if you've received any other CARES Act funding. If you have and you remember what they are, try to put those names in here. And then I just would put like a short little description of what you purchased with them. So it doesn't need to be super detailed and lengthy. It can just be like supplies and equipment or something like that. Well, I cannot type. All right. Next is the budget section. So like I said, you will have a vendor. You will have to put in the vendor. So this is where you'll want to do your pre-shopping. Find out what store you want to purchase your item from and put that here. And then you'll put either minor renovations or other activities and expenses. The item name, so table, and then a rationale. You would just put how it's going to help your program in meeting health and safety needs. So spreading out children, and then the cost. So like I said, if you want to add tax, you should do that in this section, just so that you're not surprised later by having to pay out of pocket. And then I'll just put Walmart. And so that's kind of what that will look like. Then you would just add for each line item, and you can add as many as you would like. There's no limit of how many items you can request. As far as like minor renovation work, if you're doing just the supplies, you would just put each supply on here to show what you're buying for it if you're doing the work yourself. If you're getting a bid from someone, you would just put that person's name in the vendor and then the minor renovations, and then fill out the rest of that. You do not have to submit uploads of screenshots and stuff like that like you had in previous grants with us. We are just going based off of what your narrative says on here, and then you would just provide your receipts later. So this is where we will put in the W-9 information. This is a lot better than uploading a separate form, if you ask me. So that's why we really encourage this way. And then we also have that for the direct deposit as well. So when you submit this, this is encrypted, so none of our staff can see it until it reaches the finance department. So this is a safe way to submit that. We do encourage, if you are doing a paper application and emailing us that in, we do request that you mail in your financial documents, just because we don't know how safe the email is, and we don't want your information compromised. And then there are some assurances to read, just about the deadlines and stuff like that. And then an electronic signature. And so you can either save and go back to it later. Once you hit save and submit, that will be submitted into us. and you cannot redo anything on your application once you submit that. So that will go in and that will be used to be scored. So once you really want to make sure that it's complete and how you want it before you submit that. So that is our WLS piece. We are very excited about this piece because it does make it a lot easier for you all to apply. And then I think that is all I have. So now we can move on to the questions. So if you would just, once again, just type in the chat box if you have any questions. We will answer those aloud. If we don't get to all your questions, we are making a Q&A document where we will put on our website and send out to you so that you have those answers to all of those. We will try to refrain from asking about specific request items just because every case is so different. So if you are thinking about a specific item, just remember that your item needs to help you mitigate the spread of COVID-19 and meet other health and safety needs. And we really are judging these on a case-by-case basis. So what is approvable for one program, it might not meet needs of another. So we're trying to be consistent. We don't want to guarantee anyone an approval when we don't know what that will look like yet. So I will open it up to Kathy. She is going to help read some of the questions to us.
Okay, here we go. Can you hear me okay?
Yes.
Okay. First one is, are these grants only for early childhood or do they work for school age children as well?
This is for school age programs as well. So any eligible licensed childcare provider can apply. So that's any program with a license number.
What do you mean by competitive?
So we are going to be scoring these applications and going off of your narrative and how well it is written and how your items are going to be related to COVID-19 and meeting health and safety needs. Due to limited funding, we can't award everyone. So we are making this competitive and making sure that you guys are completing thorough applications.
If I have already applied, would I be able to resubmit a new one?
We are currently working on this for those providers that submitted before the webinars. We are hoping to make this kind of a one-time resubmit because you weren't given the information right away. So this will not be open to everyone. It will be open to just those providers that submitted on Monday, because I know some providers thought that Monday, the launch date, was also the due date. So we wanted to avoid some of that confusion and let kind of a one-time request happen. So if you are wanting to resubmit, just let us know through our grants email, and we will notify you when some more information comes available.
How much money does Child Care Aware have to award to Kansas providers?
We have a little over $2 million to award.
Do you want original receipts or copies?
It doesn't matter as long as we have those receipts and stating the vendor, the price, and we will put this on the Q&A what your receipt needs to entail.
How long will it take to be approved?
We are hoping to let everyone know by mid-May.
If there is one line item out of 10 that is not approved, does that deny the entire application or just that line item?
Nope, we are doing partial approvals. So if one of your items does not meet their criteria, you are eligible to still be approved for the other items as long as you are scored high enough.
If we apply for both categories, is the limit 4,000 per category or 4,000 total?
4,000 total. So we are looking at the total and the categories just fit into that.
Do we need actual estimates for work or just list costs?
We will need estimates. You don't need to upload those, but we do want them to be as close as possible to what you're going to be expecting to be paying. So we do encourage you to get estimates done.
Is it possible to print out a copy of this form before filling it out online so I know what information I need to gather?
Yes, and you can always have it on your screen for a long period of time. There's no limit on how long you can stay on your application. So you can do whatever is easiest for you in filling this out. We want you to feel comfortable in doing that.
If you are using a contractor and they will order the product for you, how do we document that in the budget?
We just do the entire bid in one budget line, since they would include just one total price.
Do we have to submit a new W-9 if we filled out one last year?
Yes, we will need updated W-9 and direct deposit
Did you hear?
forms. Can you hear me?
Yes, sorry, I think we
Okay.
glitched a little.
Okay. Yes, we will need updated direct deposits and W-9s for this round.
Is there a limit on cleaning supplies?
There is not a limit on cleaning supplies, just if you stay under that, that limit of the awarded funds.
If we price something from one vendor and end up using a different one, is that okay?
Yes, that is okay. You can make note of that on your receipt. If it's under the price or over and you're paying the difference, you would just make note of that on your receipts.
What do you mind scoring? Can you hear me?
Okay, what was that? Sorry. Uh-oh. I think you're freezing, Kathy.
Can you hear me?
Yes. You're cutting out a little bit.
I think I'm frozen.
All right, I can hear you.
Sorry, my internet's going in and out.
Awesome.
Can you hear me?
Yes.
Okay, while she's frozen, I'll fill in.
Thank you.
What did you mean by scoring?
We are just doing an internal scoring process that ranks each program based on their narrative. We award a certain amount of points, and then we will rank those and award from the highest scoring.
Will there be access to this webinar after this ends?
Yes, we will post a recording of this webinar on our website as well as the Q&A document that we are making with all of the questions from these webinars.
On the HERO grants, you had to remain as the licensed provider until the following October. Is there a time frame like this for this grant?
We are currently working with KDHE to figure out what that exact timeline looks like. So we will try to get that out on our Q&A document. And if not, we will get that information out to you as soon as we figure something out and have a set plan.
Let's see here. If I quit daycare after receiving this grant, is there a payback period?
Once again, we're still trying to work out the plan for this. So we will let you know as soon as we have that information.
What is the total funding? No, you already answered that one, sorry. In the supply request area, do we list each supply and how many of each supply we will need for the year? Example, Lysol, 12 of them, or 12 cans?
Yes, you would just put how many you need, and then you can add up that total cost on one line item if you would like.
If we received a grant in the fall, can we still apply for this grant?
Yes.
Okay.
You're still eligible to apply for this grant even if you have received other grants through the CARES Act funding.
Is there a scoring rubric?
There is.
How will this affect taxes?
This is taxable income, but we don't give tax advice. So if you would like more information, you should talk to your tax professional about how to go about this.
If I have a larger project to do, can I just put it in half and put in half the bid and pay for the other half out of pocket?
So you can, and you can even put the full bid, and if approved, we could award up to the amount that you could award. And then you can just make note on that receipt that you are paying the remainder.
Are we able to pay employees with this grant?
We are not going into specifics on this during these webinars. We are trying to refrain from that just because every case is different, and so we'll put more information on that on our Q&A document.
If what, nope, we already did that. Let's see, and I think you covered this, but I'll go ahead and let you just talk. Is this eligible for preschool?
Yes, all licensed programs are eligible.
Let's see, do we have access to the scoring rubric?
No, that is an internal rubric only.
Are we awarded amounts taking into consideration previous amounts awarded to our program? For example, if our program was awarded a larger amount on last health and safety, is that program likely to get less this round?
We are having programs that haven't received any other funding have a higher priority, but that's also based on the scoring as well. So that does not exclude anyone.
I think we are caught up on all questions that are not specific. Let's see, we've answered this one, but is the 2019 W-9 acceptable, or do we need to do a new 2020 W-9?
Yes, we will need an updated one for this round, and your application is not able to be submitted unless those are submitted with it.
Let's see, they're asking, will we have to show receipts and pictures?
You will have to put receipts in. You can share pictures of the items being in use. And then we would like you to put an impact story too, just showing how it's helped your program in meeting those health and safety needs as well.
The scoring rubric measured on efficiency, quality of the application.
Quality of the application and the thoroughness and completeness of the application and the narrative, and also how your items relate to meeting your health and safety needs.
see, do any narratives need to be on a separate piece of paper?
On the paper application, we do have more room on an extra page if you need it. But within our WLS system and your provider profile, you can type as much as you need to in that section.
And that is all I see that are not specific questions related to specific items.